Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Thank you for viewing today's episode on the calf strain. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can also connect with me on other social media platforms. Please enjoy this sports medicine video. On today's episode of Dr. Ozello's Sports Medicine Report, I'm going to cover the calf muscle strain. A strain of the calf muscles is a common sports injury. Honestly, it's much too common. This is an injury that is preventable and it's manageable, and you can recover from this injury. So I'm going to go over several different things to help you to prevent this injury, and if you do get this injury, that you can rehabilitate from this injury. You're going to have a better understanding of the calf muscle strain after you have finished viewing this video. Again, thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. Like I stated before, the calf strain is a very common sports injury. The calf muscles are obviously, they're located in the back part of the lower leg. We have two major calf muscles. We have the gastrocnemius and we have the soleus muscle. The gastrocnemius has two heads. It is the larger of the two muscles. It actually crosses the knee joint and the ankle joint. So I want you to remember that. It starts on both sides of the lower aspect of the femur. The femur is the thigh bone. So it starts on both sides. It runs inferior, crosses the knee joint, and then that's where you get the meat of the muscle. Again, it has two heads, a lateral head and a medial head, and it inserts into the Achilles tendon, also known as the calcaneal tendon, and the calcaneal tendon inserts into the heel bone, which is known in medical terms as the calcaneus. The soleus muscle is deep to the gastrocnemius muscles, meaning that it is closer to the bone. It does not cross the knee joint. Its origin is on the back part of the fibula and the tibia, which are the two bones in the lower leg. It runs inferior, and it also inserts into the Achilles tendon, just like the gastrocnemius muscle does. Both of these muscles perform plantar flexion, which is the motion where we bring the lower part the bottom part of our foot, which is the plantar part of our foot, where we bring that closer to the back part of the leg. So basically, if you're standing up and your feet are flat, you go into plantar flexion, you're moving onto the balls of your feet. If you are seated and you have your foot raised, the ankle motion of plantar flexion is basically moving the the top part of the foot away from the shin. So that is plantar flexion. Both these muscles perform plantar flexion. Now, like I stated before, the gastrocnemius crosses the knee joint, so it also assists in knee flexion. So the gastrocnemius is the bigger and the stronger of the two muscles. Both are extremely important muscles, and the Achilles tendon is extremely important. The calf muscles are powerful muscles that are involved in every step and every jump that we make. When we are walking, when we are running, there is a lot of force involved with the calf muscles. When we're jumping, that requires a large demand on these muscles. So these muscles need to be strong and they need to be flexible, and the same thing with the Achilles tendon. When we speak about a calf strain, the mechanism of injury of a calf strain, it can be non-traumatic or it can be traumatic. When we speak about non-traumatic, it is an overuse type of an injury where the athlete is doing too much too soon. It can be from running, it can be from jumping, it could be from climbing, any type of exercise where we use the calves, which is almost any type of exercise. But these muscles can get strained from being overused and not getting adequate rest between training sessions. Just like any other overtraining injury, there are three characteristics in the mechanism of injury that exist in all overtraining injuries, including the calf strain. It is doing too much training too soon, inadequate rest between training sessions, and some type of biomechanical fault. So the first two, they're self-explanatory. The athlete is doing too much training. They're not giving themselves enough rest time in between training sessions. The intrinsic factors, the contributing factors of the non-traumatic calf strain are several different things, but the most common ones are tightness in the Achilles tendon and calf muscles, or lack of flexibility in those muscles, or weakness in those muscles. So those things contribute to these calf muscle injuries. Also, there can be weakness in the foot muscles, because when the foot is weak, the calf muscles in the Achilles tendon have to carry a greater load. Also, there can be instability in the ankle, where there may have been an injury to the ankle ligaments. It could be the lateral ankle ligaments, the medial ankle ligaments, the high ankle ligaments. If those ligaments were injured and they were not rehabilitated completely, they have not healed completely, the calf muscles may have to take an excessive load, and that over demand could cause this injury. Also, there can be weakness in the muscles on the outside part of the calf, and that can cause these calf muscles to have a greater load. So when you think about what I just said, the calf muscles and the Achilles tendon, they're very strong and they do a great deal. But if they are weak, or the surrounding structures are weak, it is setting up the calf muscles or the Achilles tendon for an injury. So we want to make sure that our lower leg and our feet are extremely strong, and the calf muscles and the Achilles tendon are flexible, and that you are doing things to reduce the muscle tension in those areas. So we want to eliminate the extrinsic factors, which are the overtraining and the inadequate rest between training sessions, and we want to eliminate the intrinsic factors, which are the weakness in the calf muscles and the tightness in the calf muscles and the Achilles tendon, and also there may be weakness in some of the surrounding structures. The traumatic onset, or the traumatic mechanism of injury for a calf strain usually isn't like when we think about a hamstring strain, when boom, it hits the athlete really hard. The calf strain can be like that, but it doesn't have to be. The pain or symptoms can begin immediately, or they can begin hours or days after the contributing activity. So you want to think about that when you have a calf muscle strain. You may have to think back a couple days as to what caused this injury. Now, in most cases, an injury, a traumatic calf strain, occurs from an overly forceful contraction. This contraction can be from running, from jumping, from sprinting, from climbing, even from kicking, from lifting, all types of activities that really involve a strong contraction of the calf muscles. Now also, one thing I didn't point out before is usually the calf strain occurs more commonly in the gastrocnemius compared to the soleus, and it can occur in the muscle fibers in the center part of the muscle, in the medial part of the muscle, or in the lateral part of the muscle. A calf muscle strain occurs more commonly when the calf muscles are fatigued. So you want to keep that in mind when you are formulating your training plan. Your training sessions, obviously, you want them to be intense. You want to make sure you're warmed up, but you don't want to have the most intense exercises closer to the end of your routine where that fatigue can contribute to an injury. So make sure that you formulate a good plan to prevent this injury. Now, the symptoms of a calf strain: pain, tenderness, tightness, feel like a knotted type of a muscle, a limited pain-free range of motion, or you may be able to move your ankle as far as you can in each direction, but it's going to be limited in that pain-free range of motion, meaning that when you're moving it, you're going to feel pain in certain positions. So that's what I mean by limited pain-free range of motion. Also, just walking will seem to aggravate it. Doing any type of activity, it may start to loosen up a little bit while you're doing activity, but then it's going to get worse and it's going to come back with a vengeance. Usually it's worse in the morning. It may lighten up as the day goes on, but then it comes back even more intense as the day goes on and those muscles start to fatigue. Prevention, prevention, prevention. As I say in almost every one of my Dr. Ozello Sports Medicine report, prevention is easier, faster, and less expensive than injury rehabilitation. Do everything that you possibly can to prevent a calf strain. Use the tools that you learn in this video to prevent this injury. You will do yourself a huge, huge, huge favor. The prevention, what you want to do, first of all, is you want to formulate a good training plan. You want to make sure that you are training hard. You want to make sure that you are training smart and that you are starting at your current fitness level. You want to make sure that you're giving your body adequate rest between training sessions. Give these muscles time to recover. On your recovery days, you have your active recovery days and your passive recovery days. On your active recovery days, you can do stretching of the calf muscles and the Achilles tendon. You can do foam rolling. You can do massage. You can do all those things by yourself that will help you a great deal. You can get professional care where you're getting reflexology, you're getting massage on the calf muscles, you're getting chiropractic care that's going to help you to recover from your training sessions. One thing that I did want to say is I just realized I forgot to say that one of the mechanisms of injury of a calf strain is overstretching. This can happen. Anytime you're stretching, you want to make sure that you are holding a mild, comfortable stretch. Stretching is not a flexibility contest. You're not training to be a contortionist. You are trying to increase joint motion and increase the pliability of the muscle's ability to flex and to lengthen in a healthy position. You can overstretch and cause this injury. So you want to stretch, hold a mild, comfortable stretch, and you want to stretch these muscles from a variety of angles to prevent that mechanism of injury. Other things that you want to do, obviously you want to strengthen the calf muscles. You want to strengthen the Achilles tendon, strengthen the feet, strengthen the muscles on the outside of the lower leg, strengthen the ligaments in your ankle. Do proprioception exercises, which is training on an unbalanced surface or an unstable surface. Things like the Bosu ball, the wobble board, the rocker board. These are going to help your ankles, your feet, and your lower leg become stronger, and it's going to improve proprioception. Proprioception is the body's awareness of where it's at in nature. These exercises are going to help to improve that. It's also going to help to improve the strength of the ankle to prevent further ankle injuries. So you're going to build greater stability in the ankle, and that is going to help to lessen the load that is being placed on the calf muscles. So again, prevention, do everything you can to prevent this injury. Make sure that you train hard, make sure that you have a good training session. Do not overdo it. Give yourself adequate rest between your training sessions. Have those rest days built right into your routine. Then listen to your body's signals and modify your training accordingly so that you will not get this injury. If symptoms should occur, take action immediately. This is something else I say in almost every video. Do not hesitate. Take action immediately. Even if those symptoms start to dissipate, most likely the source of those symptoms is still there. So this condition is going to be recurring. Make sure that you take immediate action. You could start, first of all, by modifying your training. You want to make sure that you are allowing your body to recover from this injury. You can place ice on the muscle wherever you need to. You can do massage. You can do some light foam rolling, stretching. Get some professional care if you think you need that. As a doctor of chiropractic, I have seen plenty of calf strains in my office. You want to make sure that you get a proper diagnosis. And the reason I say that is because most people are not trained medical professionals, and they think they may have one injury, but it turns out to be something else. This is one reason that I do this video, because I want to educate people on the different injuries so that if you do get a calf strain, you will know what it is and what you can do to help yourself and the professional treatment, how that will obviously help you. And then how to prevent these injuries. Prevention, like I said, is vital. But getting back to the self-treatment, all right, do some massage in those muscles, especially in the morning. Make sure that these muscles are nice and loosened up, and later in the day. If you are training, again, this is part of prevention and recovery, is make sure you do a good warm-up. Make sure the calf muscles and the Achilles tendon, the muscles in the entire lower leg and the front of the lower leg, in the side and the outside of the lower leg, that these muscles are prepared for the activity that you're going to be doing. And then at the end, when you are done training, do a comprehensive cool down. Spend an extra few minutes stretching, moving around, allowing these muscles to recover from your workout. So do a nice warm up, get your body prepared, and then do a thorough cool down afterwards. The cool down is the best time to do your slow static stretching, because the muscles are already warmed up. They've been used, they got blood flowing to them. So stretch, do a mild, comfortable stretch, and it's going to help to increase the flexibility in those muscles. It's going to help to decrease the muscle tension. Also, if you're doing foam rolling, you can do foam rolling, target the back part of the muscle, the inside, the outside. Just use light pressure. Mild pressure is all that you need for it to be effective. And then stretch afterwards. It's going to help you a great deal. The calf strain, it's a bothersome injury. Believe me, it happens to athletes of almost all sports. I've seen it in climbers, I've seen it in hikers, in sprinters, soccer players, football players, lacrosse players, anything that you can think of where people are running, where people are putting a great deal of stress on these calf muscles. This injury can occur. So do everything you can to prevent this injury. If it happens, do everything you can to recover from this injury so that you can get back to whatever activity that you want to get back to. You can function at your highest capabilities. You can break your personal records, and you will not have a recurrence. Thank you, thank you, thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report on the calf strain. I'm Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. The calf strain is a chapter in the book, chapter 15. Again, thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. You can go to my website, Championship Chiropractic, to get more information on the book and also to connect with me on other social media sites. Please feel free to like this video. Also, please feel free to write any questions, feedback, or suggestions in the comments section below. You can subscribe to my YouTube page. I almost said the wrong thing. You can subscribe to my YouTube page, because every Thursday I publish a new video for Dr. Ozello's Sports Medicine Report, and every Monday and every Friday I will publish my other show called 2 Minutes of Anatomy, where you get a 2-minute anatomy lesson. But again, thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. Please subscribe to my YouTube page, and always, always, always remember, train hard, train smart, stay injury-free, and accomplish your